Beatrix was born on the side of the Warrego Highway in southern Queensland. Her mother recalls the relief of her first cry.
If the umbilical cord had been round her neck, if I'd bled heavily after giving birth, if her shoulder had been caught, if one little thing had been different, we would have been at great risk, Beatrix and I.
Yvette Bracefield lives in Chinchilla, 290 kilometres northwest of Brisbane. The local hospital doesn't cater for planned deliveries, so women usually have to drive more than 100 kilometres to give birth in the neighbouring town of Dalby. But the birth suite used for emergency deliveries was recently turned into a COVID ward.
It's unacceptable that in somewhere like Australia, a woman would have to give birth by the side of the road.
When Ms Bracefield presented to Chinchilla Hospital last month in labour, nurses told her to make the 1-hour drive to Dalby.
I couldn't have sat buckled in because of the strength of the contractions. So I was on my knees facing the passenger seat and I was holding on to the passenger seat and the glove box was at my back.
Since being interviewed by the ABC, Yvette Bracefield says she's been contacted by a senior Darling Downs health official and told that the birthing suite here in Chinchilla has been reinstated. A health spokesperson says the hospital is yet to provide extended care for any COVID patients.
Chinchilla has a long history of disrupted birthing services, largely due to staff shortages. Maternity services are dwindling across regional Australia for the same reason.
It's not unique to the situation in Chinchilla. We had a lot of workforce pressures both for doctors and midwives in our rural services, but COVID has exacerbated those workforce pressures.
I'm telling my story because I don't want other women to be put at risk and their babies.
Ms Bracefield and her baby were checked at Dalby Hospital and are now back home settling into family life after a traumatic start. John Daly, ABC News, Chinchilla.